Menopause is a time of many physical changes. We've all heard how it affects a woman's mood, sleep, and heart health. But now, new research reveals what happens to a woman's brain during her first year of menopause.
But I find myself being forgetful, feeling frustrated.
When this busy home entertainment executive entered her first year of menopause, 52-year-old Christy McClung noticed many changes, especially with her memory.
I would get anxious, anxiety, have trouble thinking, have trouble concentrating.
University of Rochester Medical Center researchers took a closer look at what some call menopause brain fog. They found it was most evident during the first year following a woman's final menstrual period. Gynecologist Stephen Rabin says of all the classic menopause symptoms, memory loss gets the least attention.
The hot flashes, the trouble sleeping, but memory loss is something that people don't always talk about, but it's always there. It is so disturbing not only to their quality of life, but to their effectiveness in what they're doing day to day.
But why does it happen? The theory: areas of the brain used to process the learning of new information are rich with estrogen receptors. So when estrogen levels drop, so do the functions of these critical areas. It makes sense to Christy.
If your hormones control everything in your body, it's going to control your brain function as well.
The good news, according to researchers, is if women get through this first year, their memory, concentration, and fine motor skills should come back in time, regardless of whether they took hormones or not.
Coming out on the other end, the late menopause, after a year has gone by, in this study, it showed that a lot of those cognitive abilities returned.
But Dr. Rabin says for women who don't want to wait, hormone replacement appears to help. It works for Christy.
I used the patch and it solved the symptoms. The symptoms were eliminated, and that was the most critical for me.
Just anecdotally, we see it every day that the women who are choosing to use hormones early in menopause seem to be doing much better than those who don't.
Dr. Rabin points out one weakness with the study is that it's small, only involving about 100 women. While the study indicates memory will return after a year, it says nothing about sleep disturbances, depression, or hot flashes.